Ever feel like you're just stuck going in circles with musculoskeletal pain? Like you're going to the doctor, you're getting scans, maybe they're telling you, oh, you've got this herniated disc or you've got wear and tear, but like it doesn't really explain why it just keeps coming back.
Yeah, and that's a really common experience.
It is.
And it kind of highlights the limits of just focusing on like a single physical cause for that MSK pain.
Yeah, and that's where this deep dive into dispositionalism in musculoskeletal care by Dr. Michael Vianin comes in. We've got some excerpts from his book, and I'm really fascinated because he really seems to be challenging a lot of those like more traditional approaches to dealing with pain.
Totally. And you know what's so interesting is that Dr. Vianin is like, he's a leading expert in this, and he argues for this more holistic approach, which he calls dispositionalism. And he basically says, instead of just looking at one tree, we need to look at the entire forest, at the whole system to understand why we're experiencing things the way we are.
I love that analogy.
Right.
So instead of just looking at my knee that's a little bit wonky, it's like, well, what else is contributing to this picture, this bigger picture?
Absolutely. And so the term he uses is our dispositional makeup. And so like, what is it about you as an individual that contributes to how you experience pain?
Okay, so give me an example.
Yeah.
What is something that might be a part of my dispositional makeup when it comes to pain?
Well, think about your own personal history, right? Have you had past experiences with pain, like maybe an injury in childhood or a time when pain really disrupted your life? Because those experiences can actually shape how you perceive and respond to pain even years later.
Right. So that baggage, those beliefs that we carry with us, like even about pain itself,
Totally.
those become part of that.
For sure. And even the way we see ourselves, like in the context of our lives, so our jobs, our relationships, like what we want to get out of life, all of that feeds into how we experience that pain.
Okay. So our history, our beliefs, our roles, all these things.
Yeah.
What else? What else contributes to this makeup?
Let's talk about technology. Because while things like MRIs can be amazing for diagnosing, structural issues, Dr. Vianin argues that oftentimes there's an over-reliance on these tools, which can lead to overdiagnosis and potentially unnecessary treatments.
Wait, so are you saying I can have a herniated disc and not even know it? Like, is the scan not telling me everything?
Well, that's the thing, right? Dr. Vianin points out all these studies that show that tons of people, even like elite athletes, have abnormalities that show up on these scans. Like they'll have a slightly torn rotator cuff or some cartilage degeneration, but they're not experiencing any pain.
So you can have something that looks bad, quote unquote, on the scan.
Exactly.
But your experience is fine, you're good to go.
Yeah. And this is a key point that Dr. Vianin makes, which is that structural issue itself isn't always the main problem. When it comes to pain, there's all these other factors, right, that are coming into play.
This is already making me rethink, like, everything I thought I knew about pain.
Right.
So if it's not just the structure, what else is at play? What's going on here? So if it's not always the structure, then what else is driving this whole pain experience? Like, what's going on here?
Well, this is where it gets like even more interesting, right? Because remember we were talking about our dispositional makeup.
Yeah.
So Dr. Vianin breaks that down even further into these different categories. It's kind of like peeling back the layers of an onion.
I like it. Okay, give me the layers of the onion.
Okay, so the first layer is what he calls the self, right? And this includes, your personal history with pain, your beliefs about pain, and even like how you see yourself in the context of your life, your job, your relationships, like all of it, those bigger goals that you might have.
So if I'm, let's say, someone who like really tends to catastrophize, like always imagine the worst case scenario, is that going to impact my experience?
Oh, 100%. Catastrophizing is huge, right? Because if you're constantly worried about the pain getting worse or like becoming disabled because of it, your brain can actually amplify those pain signals, making you more sensitive.
So like my anxiety about it can actually make it worse.
Yeah.
Wow.
Because our thoughts and emotions like play a much bigger role than we realize. And that actually ties into this thing called the fear avoidance model. Are you familiar with that?
Not really. Tell me more.
Yeah, so basically, our brain, right, in an attempt to protect us, can sometimes start predicting pain, like even when there's no real threat. And that can then lead to us avoiding certain activities, which then makes us even more sensitive to pain because we're not moving as we should be.
It's like this vicious cycle.
Totally.
It really is like a mind-body connection. Like we talk about it, but this is real.
Yeah, that's exactly what he's getting at. That it's not just a physical injury, but there's all this stuff. And speaking of connections, right? Another layer of the onion is culture.
Culture, okay. Yeah, I can see that actually.
Yeah.
Yeah. How so?
It's subtle, but it's very powerful. So, like, culture can influence how we perceive pain, how we talk about it, even what kind of treatments we might look for.
So, like, I'm imagining someone who comes from a culture where stoicism is really valued might not even talk about their pain.
Right.
So they might not seek help.
Totally. Or they might have certain treatment preferences, right? Like some cultures gravitate towards herbal remedies or traditional practices, while others, might be like, give me the medication or I need surgery.
It seems like it would be so important for a clinician to understand those nuances when they're treating someone.
100%. Right. It's about meeting the patient where they are with that cultural understanding. And there's another layer here we have to kind of unpack, which is the whole social determinants of health.
Okay, so we've got the self, culture, and then social determinants of health. What does that mean? What is that, and how does that play a role?
So those are things like, socioeconomic status, education level, even like your early childhood experiences, things you might not initially think of as being connected to pain, right?
No, not as obvious as like a sports injury, right?
Exactly. But it plays a huge role, right? Because Dr. Vianin talks about how people with what's called limited health literacy, so they have trouble like understand and using or like health information.
Right.
They actually experience often more pain and they don't function as well over time.
Because they don't understand what's going on in their own bodies.
Exactly.
So they can't advocate for themselves, right?
Exactly. And it's all these social determinants that can be interconnected with all the other layers too, right? So imagine like two people have the same back injury. One's struggling financially, dealing with daily stress. The other has a strong support system. They feel more in control of their life. Their recovery is going to look very different, and how they experience that pain is going to be very different too.
Right. It's not just back pain. It's their whole life.
Exactly. And there's actually one more layer that we need to kind of peel back here, and Dr. Vianin calls this sleep, metabolism, and movement.
Okay, those seem like pretty basic things. So how do they play a role?
It's all about how interconnected those things are, So, like, if you think about sleep, when we don't get enough sleep or the quality of our sleep is poor, it can actually, like, make those pain signals even louder in our brains, making us even more sensitive.
So we're really seeing how all these pieces of our lives fit together, like sleep, metabolism, movement. I wouldn't have thought those things would factor into pain so much.
Right. But it makes sense. Like, if you think about it, there are all these, like, foundational things for our bodies.
Right.
So Dr. Vianin points out, for example, metabolism. We often think about that in terms of weight.
Yeah.
But it goes way beyond that. Like, inflammation in the body, which can be connected to, like, metabolic processes, can actually make your nerves more sensitive to pain.
Oh, so it's like my whole system is just primed to feel more pain if my metabolism's not happy.
Exactly. And then on the flip side, if you think about movement, so like regular physical activity, that can actually help to reduce your pain sensitivity and even improve your sleep quality, even if it's not directly related to the area where you're hurting.
That's incredible. It's like our bodies really know what's up if we just, like, listen.
Totally.
So where does the clinician fit in with all of this? Like, if we're talking about understanding these dispositional factors, it seems like the clinician would need to take a different approach, right?
Yeah, it really requires this shift in perspective, I think, from the clinician. And Dr. Vianin actually spends a lot of time in the book talking about this, that like even a clinician's own biases or even just how they're communicating with the patient can unintentionally shape that patient's experience of pain.
So like how my doctor talks to me about my pain can actually influence how much pain I feel.
Yeah, it's like this really subtle thing, but imagine a clinician who is really just focused on what they see on the MRI, right? Like, oh, this is the structural issue, and that's kind of the extent of the conversation. The patient might walk away thinking like, okay, that's IT. That's the only reason I'm in pain. But as we've seen, there's so much more to it than that.
Right. Like just because the MRI shows something doesn't mean that's the whole story.
Exactly.
Yeah.
Now, on the flip side, a clinician who really takes the time to listen to their patient and validate their experience and like explain things in a way that's empowering, that can have a really positive impact.
It's about being a partner with your clinician.
Exactly.
Not just like a passive recipient.
Yeah, totally, totally. And Dr. Vianin talks about this, like open communication, shared decision-making, really understanding the patient's whole context, like all of those different factors. It's this shift from like, I'm the expert, I'm going to fix you, to we're in this together, let's figure out what works best for you.
I feel like that would make patients feel so much more hopeful.
Yeah.
Like empowered instead of just stuck, right?
Totally. He even uses the term like a therapeutic coach to describe what he sees the clinician's role as being, like helping to guide the patient to understand their own like dispositional makeup and how to navigate it. And actually, this is where it gets even more interesting. He suggests that patients take on like a more active role in this process.
Oh, okay. So, like, what does that look like? What would it look like for a patient to engage with this more proactively?
So imagine a patient who's like really taken the time to like read up on and understand those different dispositional factors that we've talked about today.
Yeah.
And then they come to their appointment and they're like, okay, so here's what I'm thinking about. What do you think? You know, that kind of collaborative approach could lead to a much more like personalized and effective treatment plan.
Totally. That puts so much power back in the hands of the patient to not just be receiving a diagnosis, but to be like, okay, well, what do I do with this? This is my body.
Exactly. And I think that's what's so important about Dr. Vianin's work is that it's really encouraging all of us to take this like more holistic and personalized approach to managing pain.
It's been amazing, this whole deep dive. So for our listeners out there who are maybe dealing with persistent pain, what would you say is the biggest takeaway from all of this?
I think it's just to remember that you are not your diagnosis.
Right.
Your pain is real, but it's also really complex, and there are so many different factors that are contributing to it. And the more you can understand those, the more power you have to actually address them. So don't be afraid to ask questions. Don't be afraid to advocate for yourself, to work with your healthcare provider, to find what really works for you.
I love that. It's about reclaiming that sense of agency over your own health and well-being. And that's a wrap on this deep dive into dispositionalism in musculoskeletal care. We hope that it's given you some new things to think about and that you feel a little bit more empowered in your own journey. Thanks for listening.